welcome back. It's good to see you again. So I have some good news for you. After looking at your x-rays and the results from the test that we did yesterday, I feel very confident that what you have is treatable with chiropractic care. And since what you have is treatable with chiropractic care, there's a few important facts about chiropractic that you should know. So, as you remember from the video that we had you watch yesterday, that chiropractic isn't new, it isn't experimental. It's been successfully treating cases just like yours for well over 100 years now. So more importantly for you to know that WebMD did a study on 2 million chiropractic patients over the last 4 years, and we've had a 95% success rate. So 95% success rate is huge. You will not find a better track record than that, especially in medicine today. So feel confident that you came to the right place at the right time. But most importantly for you to know is chiropractic is natural, and in today's world that's huge. Especially with our society, we've become so dependent on drugs that our body has been, created with this incredible natural healing capacity that will always be far superior to anything that man could create like drug. So, we have to rely on it first. So, have you ever thought about how the body heals? So, think of something simple like a cut. The body stops the bleeding and pulls the cut together, and before you know it, you can't even see where the cut is. That's all done through the control of a system called the central nervous system. That central nervous system knows better than what you do, better than you do about what it needs to be healthy. When there's no nervous interference to that system, the body can better, heal itself. It can better diagnose itself through the control of that system. So our first, chance at wellness and health should be natural. Before resorting to drugs with their side effects and their addictive qualities, drugs have their place, but they should be the last resort, not the first resort. But now let's talk about what got you in today. Let's talk about your condition. Well, first of all, your condition didn't just start today. It didn't just start the day that your pain started. This is something that's been going on for a long time. It's an accumulation of events and wear and tear throughout your whole life. But it didn't just start there. It started with childbirth. Now, anybody that has witnessed childbirth can attest to the stress and trauma that the head, neck, and spine are put through. But it doesn't just stop there. Think of all the hundreds of falls and spills and accidents that you've had throughout your life. You've actually needed chiropractic care the whole time that you were growing up. It's amazing that anybody has lived past 5 years of living with all the falls and hits and accidents that our bodies have gone through, but all that's left untreated. So the point is that you needed chiropractic care the whole time that you've been alive. And it would have helped you with a lot of the conditions and stuff that you have going on now, the wear and tear. But certainly remember that if you have kids or you're gonna have kids, that this is something that you should keep in mind, because they're gonna live to be well over 100 years old. And you want them to have good mobility the whole time that they're alive. But, so look at here. So imagine your lifestyle today. It's impossible to count the number of improper lifting and physical trauma events that you've gone through in your life. That's why we say it isn't just one event. This is something that's been, building up over a period of time. But just keep in mind, that's with no treatment, no prevention, no care, no effort to offset that wear and tear. Think of it this way. Think of it if you've never gone to a dentist or brushed your teeth from the time you were born until now. Think of the condition that your teeth would be in. A lot of them probably would have fallen out by now. You have years of nerve damage and tissue damage that, have essentially been left untreated. So, be pretty fortunate now that you're not in any more pain than you already were before. But keep in mind that this is something that took you years and years to get to this point. This is not something that can be reversed in just one day. Think of an example like gaining weight over a 10-year time span. You want to lose that weight in 10 days, and that's not how it works. It takes time, just as this is going to. So for now, let's talk about the findings of your exam and kind of what we found. So the spine has been pushed and pulled out of alignment, and by doing that, it's causing less flexibility. It's causing inflammation. It's pinching those nerves that run out from below each one of those individual bones of the spine called the vertebra. And the medical terminology for that is a subluxation. Now, these subluxations, they cause pain and they cause disease. But so if you look at this chart here, you can kind of see what other things are involved with, you know, subluxations in that region. It's pretty incredible. You know, those nerves, they start in the brain and they run all the way down, and they communicate all the commands to the body in that area and the organs in that area, and you know, that's how the body knows how to heal itself. So you came in with low back pain. So look in here and you can see some of the things that go along with, you know, the nerves in that area. Pain down the leg, pain in the groin, abdominal things, you know, does that not all sound familiar? Those are all things that you have, you know, that you have going on. And we experience that today, that same type of effect with our cell phones. You know, we're on the phone and there's an interference to the call. So we either drop the call or the call starts breaking up, right? And then we start running around and we're trying to, you know, go from room to room to try to remove the interference so we get the whole message. Well, that's exactly what's happening, you know, to our nervous system. There's an interference to our body's communication, and that the result of that is pain and disease. But subluxations, so they don't just cause, you know, neck and back pain. They cause all types, many different types of disease. And when we can remove that nervous interference, you'll feel better health, not only just in that area, but in many different regions of the body. And that's important, because once we remove that, you know, it's not just neck and back pain anymore. You can experience health in many different regions. So, spinal degeneration. There's 4 different types of spinal degeneration, right? And just like many other diseases, you know, like say, for example, cancer. Everybody seems to know something about cancer. The longer you leave the cancer, the more severe the stage gets, the more severe the symptoms get. So that's why it's so important that as, you know, that you start treating and preventing immediately. So you can start offsetting that wear and tear, and you can start offsetting any further spinal degeneration. Currently, I would say that you're like a level 2, phase 2. But since you can't take your x-rays home with you, I circled on this chart right here, with this area right here, what's most similar to what you kind of have going on. That way you can take this home and show it to your husband, okay? So now, since, you know, we've talked about enough about the condition, let's talk about, you know, the solution and what we can do for you. So, the adjustments. What we're going to do is we're going to adjust your spine into proper alignment. Now, we should talk about what those adjustments do for you. And when you're getting adjusted, I want you to know specifically what's going on, because that isn't really something that you can see from the outside. So 1. These adjustments. So first one, we're adjusting the spine so we can remove nervous interference. So your body has 100% capacity to heal itself from your pain and, you know, the pain that you have and the disease that you have. Secondly, we're removing the nervous interference. So your body has 100% capacity to prevent future pain and sickness. So you don't get so much sickness in the first place. But third, we're removing the nervous interference for your future performance, so that you don't get so much wear and tear in your musculoskeletal system, so you have better overall mobility your whole life, not just right then and there. But your spine has been, you know, misaligned for so long that your body now considers that misalignment to be normal, and it's going to take some time to retrain that. We have to go back in and retrain the spine, and we do that with the adjustments. And now these adjustments, we do the adjustment, we get it back in a proper alignment, and honestly, your body is so used to that misalignment that it pulls it right back out of alignment, and now it's like 3 steps forward and 2 steps back. It's going to take some time. We have to retrain it, so we continue to adjust it, and we continue to retrain it and stabilize your body into the stabilized condition. And like we said, that takes some time. It's not, you know, something that just happens overnight. That's why chiropractic, you know, the visits and the number of visits and the frequency is so important to your health. You know, those are the things that your health is dependent upon. So, but now let's talk about, you know, your care. And I've broken it up into 3 phases. So the first one is obvious. The first one is pain relief. We got to get you out of the pain that you're having. So the first one, and everybody responds a little bit differently, but your first phase, it requires treatments every day this week and 3 times a week for the next 2 weeks. And assuming, you know, and we're going to be mixing in some other therapies as well to kind of go along with those adjustments. And at the end of that period, I'm very confident that you'll be out of pain. And most people, they think, okay, I'm out of pain, I don't have to come in anymore. Well, that's not the case. Your condition is still so fragile that any misfall, any bend, any twist, that you're completely out of alignment again. Now we have to start all the way over, or even worse. So at the end of that, we continue, and we'll do like a progress exam to kind of see where you're at. And I'll be very confident that we'll be able to graduate to the next phase, which is stabilization care. Now the stabilization phase is more important than the first one because your condition is still so fragile. We want to make it, a stabilized condition so it's not as vulnerable anymore. Now, this is something that we do another progress exam to make sure that we're at that point to, graduate you to that phase. And this is also the time that if you need less care, this is also the time that we kind of turn it back, and do less if that's what, if that's how you're responding. Now, you still have to come in for a series of adjustments, but now it's 2 times a week for 3 weeks. And at the end of that time, we do another progress exam just to kind of see where you're at. And I'm very confident that at the end of that time, you'll have a stabilized condition. And once it's stabilized, then we feel confident we can move you into the final stage, which is wellness care. Now, wellness care is very, is a different kind of thing. Now, wellness care is complicated because we're never really going to eliminate the cause of your subluxation. We're not going to stop doing you're not going to stop doing the things that brought you into the office in the first place. You're still going to do, the same activities that cause subluxations. It's kind of like whitening your teeth. You get them whitened, and wouldn't that just be fantastic if they would just stay that way? But then that would require you to not eat, to not use your jaw, and that's not going to happen. Same thing with your musculoskeletal system. You're not going to stop moving. We don't want you to. But the difference now is that now, instead of having the wear and tear, beat you down until you can't walk or move, now we're going to be doing adjustments to kind of counteract that wear and tear. Doing adjustments up front is always better than doing overhaul. Wellness care is always better than sickness care. And that all goes back to, sticking to the number of adjustments and the frequency. That's so important to your health. Now, what you need is, wellness care. You need, natural care, and that's what we can do for you. But to get you to that point, I need 2 things from you. One, we've already talked about that you need to show up to your adjustments. Do not miss any. Like we said many times, the frequency and the number of visits is essential to your health. Now, secondly, I need you to attend a special class that we offer here. Now, this class, it offers very beneficial health information that I'm pretty sure that you've never been taught before. It's actually a very interesting topic that I'm sure you'll enjoy and you can get some benefit out of for your whole life. The class is called How to Stay Young for Your First 100 Years. Now, I have your tickets right here, and I have a few more for your family. So they, feel free, they can attend with you, and I'm sure that they can get some benefit out of the class as well. Now, that class is offered every Wednesday at 4 and Thursday at 9. Which one of those days can I get you to attend? Okay, 4 o'clock. So 4 o'clock. So I'm gonna write it down on this sheet here, and we'll get you scheduled up with Crystal. And like I said, if you have any questions at all about financial things, any questions, she can help you out up at the front as well, okay? So now, I'm signing off on your chart right here, and this is just saying that I've reviewed everything with you, that you're gonna comply, and I'm also gonna have you sign when I get done, and this is gonna it's just something that says that I went over everything, I've kind of talked with everything, answered any questions that you had, and that you're gonna sign and say that you're gonna comply and do the best that you can to, follow the treatment plan that we set forward, okay? Now, if you don't have any questions, we can start with your adjustments.